We're fortunate to have several distinguished speakers with us to share their expertise and perspectives. Without further ado, I'll introduce our speakers. Suzanne Biermann serves as the Medicaid Administrator for the state of Nevada. Administrator Biermann's previous work includes serving as the Director of Health Policy at the Gwynn Center in Las Vegas, and before that as the Assistant Director of the Division of Medical Services in Arkansas. She earned her JD and MPH degrees from the University of Arkansas. Terry Burke is currently a senior advisor in the ACA exchange market at Oliver Wyman and serves as interim president of the individual exchange business segment at AmeriHealth Caritas. Terry is a veteran in the healthcare industry, and prior to his current roles, he was an advisor at Positive Development and business lead at Blue Cross Blue Shield Michigan. Terry is also a dedicated volunteer fundraiser for JDRF. Kevin Deutsch is General Manager and Senior Vice President of Health Plan Solutions at Softheon, which provides software solutions to solve complex operational and service challenges for health plans and government health agencies. Kevin is responsible for ensuring the retention, satisfaction, and growth of the customer relationship. We are glad to have all three of you here with us today to share your unique perspectives and insights into the enrollment landscape and what can be done to keep people connected to coverage they need today and into the future. Let's dive in. So, as you all know, healthcare.gov open enrollment for 2022 coverage just ended on January 15th. What are the key takeaways or surprises you all have from open enrollment? And to put a finer point on it, if you were writing a news headline about 2022 open enrollment, what would that headline say? Suzanne, I'll start with you.
Great. Well, thank you so much for the opportunity to participate in this webinar, Kristen, today. This is a critically important and timely topic, and really appreciate the opportunity. So conciseness isn't always my strength, but I think if I had to try to distill this down to a newspaper headline, it would just be that historically high enrollment numbers in both Medicaid and the marketplace from last year really demonstrate that individuals really value and take seriously their healthcare and value having affordable healthcare options available.
Excellent. Terry, how about you? What's your headline?
Yeah, so first of all, this is my first time doing a webinar with Suzanne. So it's nice to meet you and it's an honor. Thank you for all that you do in the service of the Medicaid business. I have been on a webinar with Kevin before and appreciate Softheon bringing this forward along with United States of Care. I think the headline for me would be very similar to your opening, which would be something along the order of ACA Marketplace hits historic record high enrollment numbers. And then I think many of the colleagues who are running plans or have crossover between Medicaid and Marketplace plans have talked about that maybe the subhead or the tease on that for more discussion or to ask you to read my article from the headline would be positive progress sometimes contains challenging and negative unintended consequences. So with these record numbers and with this expansion of the subsidy no longer a cliff, so many more people eligible, comes a tidal wave of product choices, company choices, and people are confused. They're still enrolling in record numbers, but they're not always sure what they're enrolling in.
Mm-hmm. Thanks. Kevin, how about you?
Well, first and foremost, thank you, Kristen and the USofCare team. We're really excited to partner with you all, and to Suzanne and Terry. It's great to be on the panel with you. I know that there's quite a bit that we're looking to cover today. And starting with open enrollment, I completely agree with your sentiment. Going from the December 15th cutoff, extending it a month into January, I think we saw some interesting behavior as a result of that extension. But in general, it was a really, really strong open enrollment as it relates to not only new members getting into the marketplace, but also high retention rates. And one thing that I want to call out, there's a couple of things here based on what Terry was saying about the consumer choice aspect. As you saw in this open enrollment, there were a number of plans that exited the marketplace early on because of challenges with sustainability and other areas. And now as they get back into the marketplace, we see a number of new plan options that are available to the consumer. As one example that really struck me at a conference that I was at a couple of weeks ago, in Harris County, Houston, a given consumer has 250 unique plan options. Now, if you think about going out to any platform to go buy a product, if you have 250 options, how can you possibly make the right choice? And so as Terry mentioned, with all of the success and positivity around these increased enrollment numbers, we really have to look at that consumer education, because that is a very, very difficult piece to this puzzle that we need to make sure consumers are getting into the plan that makes the most sense to them. And I'll add one other comment before we continue in the conversation here, and that's around some of these plans getting into the marketplace for the first time. I was able to work with a number of them, and one thing that I noticed is that as a result of the Biden administration's commitment last year through the special enrollment period, the American Rescue Plan Act, through the original open enrollment, there was a number of opportunities for consumers to get into the marketplace. So if you were a consumer that had gone out in May or June, as an example, to update your subsidy or to enroll for the first time, you may not be going back out during the open enrollment period to enroll in a new plan. So I thought it was an interesting dynamic for the new payers that were getting into the marketplace this open enrollment, where there may have been a slight disadvantage to years prior because of all of the opportunities to enroll last year. So a lot to unpack, but a really positive open enrollment for sure.